Hello friends, my name is Olga. I'm a mature medical student from Ukraine, and in this video I think mostly it will be video for medical foreign applicants, for people who want to enter medical university in Kyiv or other Ukrainian medical university, because I believe the system, the subjects and the consequence are quite similar. So what you're gonna do on the first, second, third year, fourth, fifth and sixth, let's check what kind of subjects it will be. Here the folder, I open it. Only students of my university who have the special email of university, they have this access. Actually, we have here different faculties. I intended to show you this. It is medical faculty, but I see here international faculty, and maybe it will be better to watch together what inside. Okay, inside this folder, more 3 folders, dentistry, pharmacy. I will show you medicine because that's what's more close to me, and I even can compare if it is the same. Okay, 6th, 5th, 3rd, 2nd, first year. Okay, let's start from the first year. Here we have practical and lectures. Usually we have in this university, because during my first education was different, we had may have in the same day and practical and lectures, but in my university first months you will have only lectures, no any practical lesson, and then 3 months of just practical lessons. So lectures, they on the subjects you will study here. Here it's different because this is the date, usually 1st of September or the first working day of September, but because of military actions we have here a little bit different days. So philosophy, bioorganic chemistry, histology. By the way, in our program histology starts only from the second part of the first year. Here the program a little bit different, but you may see this kind of subjects: medical and biological physics, human anatomy. By the way, physics, it is maybe the only such a discipline because they usually together with math, and here at least we had no any math in our medical university, but we had the demands to pass these exams to enter our university. Humans anatomy, okay, philosophy, it's the same. So yeah, like this. And here the, I don't know what is this, maybe it's different types, but okay, let's check practical lessons. Practical starts from the 9 o'clock. Sometimes, for example, we had sometimes the earliest from the 8 and 15 starting, sometimes some lessons, but I see that for foreigners a little bit not that early. They all lessons starting from the 9 o'clock and until of mostly 6 o'clock or 4 o'clock. Just you may here in Ukrainian. Sorry about this, but this international faculty. Okay, I don't know why, but it is all in Ukrainian language, so I can just read to you what is here. First is Ukrainian language and foreign language. Here international communications. Here humans anatomy. Here medical and biological physics. Each column and each this is different group. So if you for example, first group, you will just watch this column. It will be Monday, Tuesday, Wednesday, Thursday. So you, and this, if the column, for example, for several groups, it means that this lesson will be together with other group. Here we have the histology. Again, once again, Ukrainian language and foreign language, human anatomy, philosophy, medical biology, bioorganical chemistry, and international intercultural communication. And here, Latin language and medical terminology. So it's like this. Quite similar. I may say that in Ukrainian, for Ukrainian students, we didn't have this kind of intercultural communications. It's especially for, I think, foreigners, but the rest is almost the same. It was the first year. Let's check the second year. How to... Okay, medicine. Second year, lectures. Oh, here a lot of them, I don't know. Okay, first, microbiology, virology, immunology. We had the subjects only on the third year, and here it's for international faculty, it's from the second. Physiology, hygiene and ecology, clinical anatomy. You may just read, I think, if you need. Practical lesson. I don't know this, what is difference? This is a lot, maybe looks like this. But actually the lectures and the practical lessons, they are the same. So if you had such a lectures, you will definitely for 1 month have such kind of practical lessons. So it's also microbiology and virology and immunology, medical informatics. Yeah, some subjects, they starting as a practical without any lectures, which is medical informatics. It's very briefly, not that a lot. Ukrainian language and foreign language. This is kind of practical. We during first, second, and third year, we have kind of small practical courses, small practical, for example, on surgical skills, on pediatrics, on therapeutical skills, but they are very briefly, and it's like to start to understanding, you know, the practice of medicine. It's just a start, beginning of your practical skills. Here, this is the carry about the surgical patients. It's kind of practice I'm told you about. This is caring, how to say, when you're taking care about the patient. This is therapeutical patients. It is practical also. This is biological chemistry, physiology, clinical anatomy, and surgical surgery. It's very funny, but I don't know how to translate it correctly, because operation is a surgery and chirurgia is a surgery, so it's like a surgical surgery. So second year. Okay, third year, and here all subjects connected with pathological process, because first 2 years medical students in Ukraine study normal physiology, normal anatomy, which means that everything is normal, but on the third year is pathological. For example, pathophysiology, pharmacology, microbiology, immunology, virology. It's like the continuing of the from the second year. Propedeutics of pediatrics, general surgery, we have the same pathomorphology. Here, hygiene and ecology. For me, very boring subject, but we have to learn it. Yeah, we had it. It's just stopped. We just passed it in this semester. Propedeutics in internal medicine. Yeah, internal medicine, it's what I meant. It's therapy. I think it's therapy. Maybe it's like a old-fashioned name. Now it's correctly for internal medicine. Okay, so you just may look on this. You will have each day approximately three lectures. Okay, let's check the fourth year. Okay, fourth year of study. Here a little bit could be different. Okay. I don't know why it's in Ukrainian. Wait, I will try to find this international faculty. Okay, English. Yeah, it's starting a little bit less lectures because on beginning from the fourth year a little bit it's more practical and less theoretical, so here not much lectures and they are more practical. Internal medicine, obstetrics and gynecology, dermatology, venerology. You may just watch surgery, physical rehabilitation and sports medicine, like this. Not much lectures, just 1 or 2 for a day. Okay, let's watch the practical. Practical, it's starting from the fourth year. You will have the cycles. You see the schedule. Oh, wait, I will try to find English maybe. No, English, don't know why it's not possible. But yeah, I can just tell you here like days. For example, second, third, fourth, fifth week, 6th week of study, so 19 weeks here, and it's like horizontal lines for each group, not columns as it was before in the previous schedules. And here, for example, this is first group. They will have this 1, 2, 3, 4, 5 weeks of internal medicine, just internal medicine. So the process is completely different because during first, second and third year you have to you can have in one day different subjects, a lot of tasks. You have to learn a lot on and prepare for each subject. But here from the fourth year you may study just one subject, and so you will be less overloaded, and it's a little bit, not just a little, but it's really easier to do not be turned into a parts what you should do, what you should learn now, but you will learn just one subject, and it's much more better and easier in comparison to third year. And it's all years after third year they are like this, where you study medicine for cycles. On the here's the fifth year, here a little bit more subjects, but you can see here pediatrics, anesthesiology, intensive therapy, physiology, internal medicine, neurosurgery. It's a little bit more specific subjects, not just the general surgery, but for example, surgery and neurosurgery, they're different because you had the like background in the previous year. And the practical fifth year of study. It's like this. You see here the periods of study, one subject's much more longer than in comparison to this fourth year. So on fifth year, for example, here in inner medicine, here infectional disease, I don't want to count, but the length completely maybe the same. Anesthesiology, clinical immunology, obstetrics, neurosurgery, oncology. I don't know what is this. Cannot understand what is this means. Pediatrics, surgery, physiology, Ukrainian language. So it's like this. And the winter holidays starts 12th of December and lasts until 31 of January. So you have 1 month and a half of winter holidays. And let's check the last year of medicine of the schedule, because in Ukrainian, for Ukrainian students, on the 6th year we do not have any lectures, and here also this folder is empty, so it's just full of practice, just practical 6th year. I will try to find for you the English. They're all in Ukrainian, I don't know why. Here the same, you see the same system. Here you have to study inner medicine for here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, and other. It's pediatrics, pulmonology, social medicine, infectious diseases. I don't know what this is, maybe children's surgery, obstetrics, surgery, laboratory diagnostics, and children's infectious disease. So it's a little, not a little, but much more specific subjects. But inner medicine is huge part of, because it's like a base for a lot of different disease. So you had an opportunity to watch what kind of subjects we are learning usually, and I think the program a little bit different for Ukrainian and for international faculty, but in general I think it's the same. So now you will know what you will learn during all this 6 year. Thank you for watching and see you in my next video. Bye.